everyone, welcome to Center of Balance Live. I'm Sinampua from Center of Balance, the acupuncturist. Well, so what is our topic today? We're going to talk about acupressure points. I'm going to teach you acupressure point for finger joints pains. Right, and before we start, please share, like, and comment. Share this live video on your post, on your page, right? Whether you're on Facebook or TikTok, right? And then like this live video and comment down there. Type something in it and let me know where you're from, right? Now, I want to figure out one thing today. Are you an acupuncturist or you're not? Okay, please let me know. And where are you from? Where are you from? Okay, are you an acupuncturist or you're not? Because what I found is on my page, I share on Facebook into the other page, my teaching page, and for acupuncturists. And some of you actually an acupuncturist, right? So this, whatever I show you, you do the acupressure point. For you as an acupuncturist, simply put the needle in. It works. Needle works better than acupressure points, right? But my intention for the live webinar is actually trying to help more and more people, and I want to reach more and more people, of course, and I want to help more and more people. And without your help, I wouldn't be able to reach that and to meet my goal, right? So I want you to share this. Please share this live video and tag your friend, your family, who that you think they have fingers pain, joint pain in your fingers. They suffer from arthritis, they get stiffness, they get pain, and they can't hold a cup because it's painful, and they complain about that. Please tag them in, because this live video is gonna help them, right? Much appreciate your tips, helpful from Fiji. Thank you. That's fantastic. Okay, let's start. No, the same as before. I'm going to ask you the same question every time. Okay, do you suffer from any pain in your joints? I mean finger joints. So a lot of people actually on TikTok and say, well, I suffer from arthritis. Do you have any tips for arthritis? Yes, I have tips for arthritis. But if we're talking about acupressure points, I really need to know whether the pain is in here, or here, or this joint or this joint. Why is it so important? Because when I show you the acupressure points, I'm going to show you something that can relieve the points. Today we're talking about pain over here. Then I need to know, when I know the pain is in here, I know which point to go to, which point to show you, right? If you're talking about pain in here, and I ask you to rub here, it doesn't make sense for you, right? Because that doesn't connect to here. It won't help your neck pain, for my acupuncture points, okay? I won't go there. Now, so we need to know, if you suffer from arthritis, please let me know what joint that you have it. You suffer from it, okay? All right. That's that. Let me ask you, if you suffer from arthritis joint pain in your fingers, please say yes. Now, do you know anyone who suffers from arthritis in the fingers? Or they haven't been diagnosed with arthritis in the fingers, but they complain about pain. They talk about symptoms now. tingling, numbness, tightness, or coldness in their fingers. Do you know anyone who suffers from that? If yes, if you do know someone, please say yes. Now, if you or your friends suffer from that conditions in the fingers, either pain, numbness, coldness, tingling, achy, tightness, if they suffer from those on the fingers, well, they may feel worse in the morning, first thing in the morning. As the day go, they feel better. If they move, they feel better. And that's good. That's good sign. Why is that? Because it's not as bad. There's some other 24 hours, 7 days, they get pain in there and stiffness in there all the time. Doesn't matter how much they move it, the pain get worse and worse and worse, and that's not good. That's not good. All right. Yes, you. Yep. And some of them in the end, that you see that the fingers actually bend. They can't actually make a fist, or they can't actually move it properly because it's been damaged on the joint, and the joint form to differ. It's not straight at all. It goes wonky on the fingers. You may see some people, some elderly patient, they have that. Right? In some of them, they don't have any pain anymore. So what does it mean? It means that with arthritis, to some stage, you won't have any pain. So now the question is, with arthritis, people ask you, can you cure it? Can you fix it? My patient asked me this question. I always tell them that thing. With arthritis, as an acupuncturist, if I say, hey, yes, I can cure it, yes, I can fix it, and there became a problem. Why is that? Because in this medical term of arthritis, as an acupuncturist, I can't claim that I can fix it or I can cure it. That makes sense? I get trouble. Now instead, I always ask my patient, with arthritis, let's put it that way, with arthritis, whether it makes sense to you or not. Let's put it that way. With arthritis, do you worry about the pain or worry about the arthritis? Is the pain stopping you moving, make you uncomfortable, or is the arthritis? Have you ever thought about that? Because what happened is your doctor put a hit on it and say that you have arthritis. Then you go online and check all those things. Oh no, there's no cure, blah, 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 blah. But in fact, I just mentioned that a lot of elderly patients, they have pain in the finger joints for a long time. And then after a few years, after 10 years, after 20 years, and you look at their fingers, it's cooked, and you ask them, is it painful? They said, no. No longer any pain. It was painful, it was a lot of pain. But the question is, why didn't they get any pain anymore? You see? So now, yes, it is the arthritis that you suffer from pain, but no, the pain is not caused from the arthritis. is the blood circulation issues. Is the blood circulation issues. Does it make sense? If the pain, according to Chinese medicines, is the blood circulation stop there or go slow, that there is a blockage over here, not enough circulation, that causing the pain. So those people that you see their fingers onky, not straight, and they don't feel any pain, the body balance itself, and now they get better circulation. That's why they don't feel pain, they don't get stiffness. And no one, the Western doctor, the GP, wouldn't able to explain this. Why wouldn't they get pain? Why would they get pain for so many years and then suddenly the pain just went away? I meet a lot of elderly patients. I look at their fingers. I ask them, look like you have arthritis. Is it still a problem for you? They said no. Years ago, it was so painful for many, many years. And then there's no longer any pain. I said, what did you do? I didn't do anything. I tried a lot of things and it didn't work. So for me, once I know the truth about the arthritis, for our treatment is how to get the circulation back to the fingers earlier. If there's anything that I can do to increase the circulation, to unblock the blockage, and get the circulation back to the fingers joint, then you get relief. And then you keep doing this over and over again for days and days, and then your body get used to push the blood circulation into your joint. Then you don't have to wait for 5 years, 10 years, 20 years to get relief from the finger joints. It could be just 1 year, it could be just few months that you no longer feel any pain in your fingers. Well, does that make sense to you? Right. So this is very, very important, because I want to share with you. You have to have the concept. You need to believe in it, that you can actually get more blood circulation to your fingers, then stop the pain, tingling, numbness. Okay, let me show you. Right now, this is in the morning. At the moment, if you're in New Zealand, please move your fingers. Test it out. Test it out. Do you feel stiffness or pain? And how bad is it? Out of 10. How bad is it out of 10? 10 is the worst. 1 is it keeps very minimum of pain or tightness, and then 0 is nothing. Okay, now let me show you the points. It's so simple. If you have pain over here, and again today we're going to show you distal point strategy. Well, in the last 2 weeks, I've been showing you distal point strategy. When it comes to acupuncture, acupressure point, there are 2 strategies. Point selection strategies. There are 2. One is local point strategies. The other is distal point strategies. And yes, with the fingers, I figured out that local point strategy work better than distal point strategy. It doesn't mean that distal point doesn't work, but let's try the local point strategy first. If it doesn't work, then I can show you distal point strategy. But I've been testing for years, then distal point strategy actually work better than local point strategy work better than distal point strategy, and the pain in the finger joints. Now, when I say local point strategy, it doesn't mean you have to go and massage the finger joint. No, some of it is very painful, and you can't even touch it. You can't even touch it. Okay, now over here, if you've been following me, you know that, hey, this is the point. This is the point. Okay. Hi, happy day. How are you? How many times can one apply acupuncture treatment to patient with knee joint pains? How many times? A lot of times, until pain's gone, until you fix the problem with acupuncture. Yeah. So you can do it many times. Once a day, sometimes twice a day acupuncture if it's very severe. If they don't respond very well to acupuncture, then again there's could be a structural problem that you need to do structural acupuncture. If it's a organs problem, then you need to fix the organs first. Bring the organs function better first. So we have class for that. Okay, now over here, you need to massage here, 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 here. Okay, let me draw the points for you first. Right, so between thumb and index fingers on the palm area, over here closer to the index fingers. So all the point, you see I mark the point very close together, very close together. And over here between the index and the third fingers, you see that? This is all the point. So between the middle fingers and the ring fingers. So look, I'm gonna mark this a bit further. This is not right. This is not right. Why is that? Because I miss a lot of point in between. You see that? So those point, those dots that I marked is where I need to focus on for acupressure. Put some pressure on it later on. So look at that, and look at that. So I'm going to put more point in between those. You see, that's the difference. Now it's much closer now. So again, you see all this, and over here as well. On the palm, on the thumb area over here on the thumb. So see 1, 2, 3, 4, 5, and 6. Right, 6 different area. That once you loosen up over here, the muscle is not as tight over here, and it actually creates more circulation over this part and push the circulation to the fingers and thumb. Then you can move it again, and it will give you relief. Right, let me show you the technique right now. There's a few techniques in here. You use your thumb, but make sure that this isn't the tip of your thumb, but make sure that the fingernail is not as long, not too long for you. Okay. Second is the knuckles. So use your index fingers and bend it down and push your thumb on it. Right. And you can use your thumb, the knuckle of the thumb as well. So make a fist like this. Give a thumbs up like this. Right. And then press the tips of your fingers in the joint, index fingers joint over here. And then you're using here. Okay. Those 3 tools that everyone have it. Unless you don't have hand, then you need to get someone to help you with that. If you don't have one hand, then you can do it on this side. This side is painful, then you need to get someone to help you with that. Okay. Now, let's start it. Let's use my thumb first, right? Over here. Every point that when you point in, closer to the bone, press it in, and rub it. Count to 10. If it's painful, if it's tender, count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's it. And move to the slow move a little bit, and second point. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then move a little bit again. From here, just move a little bit. And again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If it's painful, give it 10 times. If it's not painful, no tenderness spot over there, move to the next one, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And test it out again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You finish one. Next, you go to here between little fingers and ring fingers over here. Let's do the knuckles on the thumb. Push in here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's it. Between the middle fingers and the ring fingers, you should not go like this. Index fingers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, I don't have much pain in here at all. I don't feel, but I do it anyway. Be with you guys. And so between here, and you guys can do either the knuckles over here, or your thumb. Okay, I'm going to show you this. I'm going to use this tool over here, and this is very good too. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's very painful over here for me. 1, 2, 3, not as bad. 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alright, that's it. So any of you, if you just join us, or if you've been joining us for the last few weeks, please share this video and tag the person that you think that they need, that this will benefit them. Please share with them, share to their posts, take their name in so they know that this is for them. Right? Okay, over here, I'm going to use other technique in here. I'm going to use this one. This one's better. 1, 2, 3, 4. Remember, over here you need to closer to the bone. The second one. Okay, this is the thumb, the first one. The second is the index fingers. Closer to that, you feel more intense. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Right? So okay, this is so painful over here. Oh, for my one, it's so painful. For those, if you just grab a few points, you go over it and you find that there's 1 or 2 points particularly painful. Those are the points that you need to focus on. So you can focus on those for 2 more times. Like this point and this point for me, it's so painful. So I forget about those, and I go back to this point and to 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and release, and push it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Right, makes sense? And the second point over here, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Release. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Does it make sense? So those are the points, different. And focus on those points. All right. And over here, look at over here, this one, and keep going. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Especially you have pain in your thumb, and this is going to help a lot. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, if you feel particular pain over here, please do more in there. Well, for those of you who suffer from arthritis, finger joint pain, or you haven't been diagnosed with arthritis, but you do have pain or stiffness in your fingers, now we finished one set of treatment, DIY treatment. Please move your fingers again. If you suffer from both sides, now you feel this side where we just work on it, it'll be much better, much easier than that side. Let me know, how bad is it now? How wild do you feel? Right? So on TikTok, please hit the follow, okay, and go to our page. And on top of our page, there are a lot of short video, 1 minute video, back pain, neck pain, knee pain, hip pain, sciatic pain, ankle pain, wrist pain, elbow pain. You can find all the video in there. It's very short one. Please go for it. If you want to learn more details, like today, live video recording, we have a lot of it, like neck pain, knee pain, headache, migraine, and upper back pain, shoulder pain, ankle pain. We have covered all this topic, and we can send to you the video for free. And what you need to do is go to the link on our page, click it in, and register yourself over there. Right? We have lower back pain already. Please go and use it. Yes, use the lower back technique. Good on you. Feel better, also alert. No problem. Thanks for your quick teaching. Do you ever use tennis ball? Yes, you can do tennis ball for that. No problem at all. Yeah. So for the race major paratheatica, we can help you with those. A lot of hip bursitis. Yes. Then again, when it comes to here, if you don't feel any relief from your fingers, there's a couple of things that you need to be aware. One is there's a structural form problem in there. That's first one. Second is the organs. All meridians connect to the fingers, and all the meridians connect to one of the organs. Each meridian connect to one of the organs. If the organs not function very well, then hasn't got enough energy and blood circulation to support the blood circulation to your fingers. Therefore, it doesn't work so well. So what can you do for these people? Please, you need to go to a local acupuncturist or Chinese medicine herbalist, okay? Or you can see us, go to our website and send us an email and let us know what your conditions, and we can set up consultations, online consultations, Then depending where you are, if you have a herbal shop, Chinese herbal shop around you, we can give you a prescription. Then you can go and get your prescription. Right? If you don't have the Chinese herbal shop around you and local, you can't get Chinese herbs. Well, we will send the herbs to you. But again, we need to check whether your country allow us to send you the herbs. Right? If you do this, it's not working very well for you, this is something that we can do for you. And please send us an email. We'll get a practitioner to look after you. So we do have online consultation. Okay. Now, if it's more serious and there's a lot of pain, if this doesn't work for you, we can show you other technique. If we can't send herbs to you and you don't have a herbal shop around you, what we can do for you is we can set up a consultation and we take all the notes and make a diagnosis according to Chinese medicines. Then we film a video, tailor-made the video for you. We'll send it back to you to show you how you can stimulate the points to boost up your organ function. So once your organ function is better, then you get more circulation into your fingers and you feel better, right? So keep going. If you feel better in your fingers today when you practice this, keep going every day. Every day. Do once a day at least. You can do a couple times a day, or whenever it's painful, you do an extra one. Okay? Do an extra one. And then you may find that while you keep doing it, it keep coming back. That is normal. As long as the pain is decreasing, you get better and better and better. Each time it comes back, it's not as bad. When it's come back, it's still very painful. And the pain that when you do this, it only gives you a little, like 1 or 2 hour relief. As you do it for 1 week, 2 weeks, 1 month, 2 months, it still only give you 1 or 2 hours relief and not seem to be able to get any further. That's the time that you should make an appointment with us. We'll go to online. We'll figure out what is the underlying issues. Then we can give you advice and we can film video for you to show you other acupressure points that would help you. And we can send herbs to you if your country accept our Korea herbs to you. So we can do that. So then hopefully you get better from there. Okay? I'm not in Australia. I'm actually in New Zealand, Hamilton. Knee pain, arthritis. Where about are you in Australia? We have a lot of friends in Australia that may be able to help you. Do you have any pressure point to open all the quiver, especially? No, I don't have that. Sorry, I'm not a psychic. Okay. A lot of people ask me about this. Sydney. Well, I think Sydney's in lockdown at the moment. So with knee pain, I would suggest you go to our page. So follow us and go to our page. We have some video that actually 1 minute that you can learn some acupressure point for your knee pain. Do it. But for arthritis, it's a very severe one. We normally suggest acupuncture with Chinese herbs. Okay, acupuncture and Chinese herbs. Yeah, lockdown. I'll be able to send you some contacts in Sydney that would be able to help you. And then, or if you like, because it's in lockdown, then if you want to see someone, we'll be able to help you. Go to our page on the link on the top, click it in, and there's my website over there. They say my website. So go to my website and click into our website and send us an email and let us know what your condition is, and we can book you in our appointment that we can do an online consultation, and we'll make you a plan how we can help you We'll show you some acupressure point, and we'll figure out whether we'll be able to send you herbs or not. If we can send you herbs or send you some herbs, then we can do it distantly. We have a lot of people recover that way. We have people in Auckland, we have people in other places, and they can't come to see us, but we actually give them herbs and teach them some acupressure points, and then send them, if needed, we send it to the local acupuncturist and to get acupuncture. So we can work with anyone, right? All right, thank you very much for today, and remember, tomorrow same times, 9 o'clock in the morning, I'm going to do another live video for you. And if you don't want to miss any of our live video, please go to our page and register on TikTok. Click the link and register yourself with one of the choose your topic and register, and then we'll send you the recording video as well as a reminder to show you where our Facebook is, because all the videos are on Facebook recording in there, and we'll send you a YouTube link as well and let you know our YouTube recording live webinar. So I'll send it into your email, so you keep it in there and you can watch it for the rest of your life. Make sense? Where are you doing? You live? I'm in Hamilton, New Zealand. All right, we have clinic in Dinsdale, Hamilton. We have clinic in Auckland, and we have clinic in Raglan. So if you happen in New Zealand, in these places, or you would like to travel to us, we have people drive 2 hours to come to see us. We're locked down level 3 at the moment. We can't open. Once come to level 2, you guys are welcome to visit our clinic. We can help you from there. Right? Canada. Which part of Canada are you from? So I have friends in Canada as well, and Vancouver, and they can help you if you need any help. Please let us know, and we can send the details to you in Canada. If you're in other places of Canada, I probably don't have the contact for you, but you can find your acupuncturist yourself. If you can't find anyone, hey, we're still able to help you online. Right? If you need any help, book online, and we can get a consultation online, and we'll be able to help you from there. All right, stay awesome, and I'll see you tomorrow. Bye bye.